Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, we'll be talking about understanding delayed growth and how it's treated. So, if you like the video related to total health, I would like to request you all please share, subscribe the channel, hit the bell icon, and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Understanding delayed growth and how it's treated. A growth delay occurs when a child is not growing at the normal rate for their age. The delay may be caused by an underlying health condition such as growth hormone deficiency or hypothyroidism. In some cases, early treatment can help a child reach normal or near normal height. If you suspect your child is not growing at a normal rate, make an appointment with their doctor. It may be a sign of other health issues. Symptoms associated with delayed growth: if your child is smaller than other children their age, they may have a growth problems. It typically considered a medical issue if they are smaller than 95% of children their age and their rate of growth is slow. A growth delay may also be diagnosed in a child whose height is in the normal range but whose rate of growth has slowed. Depending on the underlying cause of their growth delay, they may have other symptoms. If they have certain forms of dwarfism, the size of their arms or legs may be out of normal proportion to their torso. If they have low levels of the hormone thyroxine, they may have a loss of energy, constipation, dry skin, dry hair, and trouble staying warm. If they have low levels of growth hormone, it can affect the growth of their face, causing them to look abnormally young. If their delayed growth is caused by stomach or bowel disease, they may have blood in their stool, diarrhea, constipation, vomiting, or nausea. Now, causes of delayed growth. Delayed growth can have a wide variety of causes. The most common cause include a family history of short stature, that is height. If parents or other family members have short height, it's common for a child to grow at a slower rate than their peers. Delayed growth due to family history is not an indication of underlying problem. This child or the child may be shorter than average simply because of genetics. Now, constitutional growth delay. Children with the condition are shorter than average but grow at a normal rate. They usually have a delayed bone age, meaning their bones mature at a slower rate than their age. They also tend to reach puberty later than their peers. This leads to a below average height in early teenage years, but they tend to catch up with their peers in adulthood. Now, growth hormone deficiency. Under normal circumstances, growth hormone promotes the growth of body tissues. Children with a partial or complete GH deficiency won't be able to sustain a healthy rate of growth. Now I'll be talking about hypothyroidism. Babies or children with hypothyroidism have an underactive thyroid gland. The thyroid is responsible for releasing hormones that promote normal growth. So delayed growth is a possible sign of an underlying or underactive thyroid. Now, Turner syndrome. Turner syndrome is a genetic condition that affects females who are missing a part of one X chromosome. TS affects approximately in 2,500 females. While children with TS produce normal amount of growth hormone, their bodies don't use it effectively. Other causes of delayed growth. Less common causes of delayed growth include Down syndrome, a genetic condition in which individuals have 47 chromosomes instead of the usual 46. Skeletal dysplasia, a group of conditions that cause problems with bone growth. Certain types of anemia such as sickle cell anemia, kidney, heart disease, digestive or lung disease. Use of certain drugs by the birth mother during pregnancy. Poor nutrition, severe stress. Now, diagnosis of delayed growth. Now, your child doctor will start by taking a detailed medical history. They will collect information about your child personal and family health history, including the birth, mother, pregnancy, the child length and weight at birth, the heights of other people in their family, information about other family members who have experienced growth delays. The doctor may also chart your child growth for 6 months or more. Certain tests and imaging studies can also help the doctor develop a diagnosis of hand and wrist. X-ray can provide important information about your child bones development in relationship to their age. Blood tests can identify problems with hormones imbalances or help detect certain disease of the stomach, bowel, kidney, or bones. In some cases, the doctor may ask your child to stay overnight in the hospital for blood testing. This is because about 2/3 of GH production happens while the child sleeps. Also, delayed growth and small stature. may sometimes be an expected part of a syndrome that your child has already been diagnosed with, such as Down syndrome or TS. Now, treatment for delayed growth. Your child's treatment plan would depend on the cause of their delayed growth. For delayed growth associated with a family history of constitutional delay, doctors don't usually recommend any treatment or interventions. For other underlying causes, the following treatment or interventions may help them start growing normally. Now, growth hormone deficiency. If your child is diagnosed with a GH deficiency, their doctor may recommend giving them GH injections. The injections can usually be done at home by a parent, typically once a day. This treatment will likely continue for several years as your child continues to grow. Your child's doctor will monitor the effectiveness of the GH treatment and adjust the dosage accordingly. Now, hypothyroidism. Your child's doctor may prescribe thyroid hormone replacement drugs to compensate for your child's underactive thyroid gland. During treatment, the doctor will watch your child's thyroid hormones level regularly. Some children naturally outgrow the disorder within a few years, but others may need to continue treatment for the rest of their lives. Now, Turner syndrome. Even though children with TS produce GH naturally, their bodies can use it more effectively when it's administered through injections around age 4 to 6. Your child doctors may recommend starting daily GH injections to increase their likelihood of reaching normal adult height. Similar to the treatment of GH deficiency, you can usually give the injections to your child at home. If the injections are not managing your child's symptoms, the doctor can adjust the dosage. There are more possible underlying causes that the ones listed above. Depending on the cause, there may be other available treatments for your child delayed growth. For more information, talk to their doctor about how you can help your child reach a normal adult height. Now, what is the outlook for children with delayed growth? Your child outlook will depend on the cause of their child growth delay and when they begin treatment. If their condition is diagnosed and treated early, they may reach normal and near normal height. Waiting too long to start treatment can raise the risk of short stature and other complications. Once the growth plates at the end of their bones have closed in young adulthood, they won't experience any further growth. That's all about the fitness in this video. I hope you all liked it. I'll definitely come in the next video with my another content. Till then, God bless you. Bye bye and take care.